Vilazodone is one of the medications which is classified as antidepressant. This is one of the new medication that is used to treat depression, and interestingly this medication is having dual action. It acts as a serotonin receptor partial agonist and it binds to 5-HT1A receptors. Therefore, it can stimulate the serotonin receptors partially. Vilazodone also inhibits reuptake of serotonin at the presynaptic neurons. So it acts like SSRIs. In this way, this medication improves the mood and energy in the people. Vilazodone should be given along with food, and its beneficial effects can be observed after several weeks of the treatment. It is due to modification in neuronal transmission that brings antidepressant activity. Therefore, after 6 to 8 weeks of the treatment with Vilazodone, an improvement in the symptoms can be observed. So in this video, we are going to discuss the important points about this medication, like how it works, what are the important precautions, side effects, doses, all these things we will discuss in this video. First of all, let us see how this medication works. Vilazodone acts as a partial agonist at 5-HT1A receptors. These receptors are autoinhibitory in nature, so when they are activated, they initially reduce the release of serotonin. However, on continuous action, these receptors are going to be desensitized, which results in the loss of autoinhibition. This leads to increased release of serotonin, leading to increased serotonergic transmission. Vilazodone also blocks serotonin transporters just like SSRIs. When the site is blocked, serotonin cannot be taken back into the nerve terminal. This increases the levels of serotonin in the synapse. All these actions can bring antidepressant activity. Now let us see the precautions of this medication. Vilazodone can cause mydriasis, resulting in the dilation of pupils. Therefore, in people with narrow angle glaucoma, it should be carefully given. It is a condition of abnormality in eye structure that reduces drainage of fluids in the eye. It increases the intraocular pressure, leading to angle closure glaucoma. It may result in eye pain and pressure in the eye. In such conditions, Vilazodone should be carefully used. This medication may slightly increase the risk of bleeding. This may be more troublesome when other medications like aspirin or other anticoagulants like warfarin are used. NSAIDs may also increase the risk. Therefore, in presence of these medications, Vilazodone should be carefully used. Another important precaution is the development of neuroleptic malignant syndrome. This is a condition that is involved with a few changes in the mental status. It may result in confusion, muscle rigidity, hyperthermia, raised body temperature, and palpitations, irregular heartbeats. Even though rare, Vilazodone may be associated with neuroleptic malignant syndrome. So if you observe any such symptoms, you should use this medication carefully. Vilazodone can also produce another condition called serotonin syndrome. This results due to the elevated levels of serotonin in the brain, and this condition can be produced by combining the other medications that again increase the serotonin levels. It results in a few symptoms like agitation, hallucinations, increased heart rate, elevated body temperature, and muscle incoordination. Serotonin syndrome can be produced by other medications which increase the serotonin levels. SSRIs, selective serotonin reuptake inhibitors, SNRIs, serotonin and norepinephrine reuptake inhibitors, TCAs, tricyclic antidepressants can increase the serotonin levels. Atypical antidepressants like bupropion, mirtazapine, and trazodone may also increase the serotonin levels. CNS stimulants like amphetamines and anti-migraine agents like triptans can also produce serotonin syndrome. Vilazodone may cause hyponatremia, resulting in the loss of sodium from the body. It is due to increased release of antidiuretic hormone, which is improperly secreted. It results in the loss of body fluids and may result in few symptoms like diarrhea, nausea, xerostomia, dry mouth, dizziness, and insomnia. This hyponatremia can be observed in the early days of the treatment with Vilazodone. This medication can also increase the risk of seizures in the people. Therefore, in people with any previous history of seizures, this drug should be carefully used. People who are having the risk factors or using other medications like tricyclic antidepressants, SSRIs, or MAO inhibitors may also have the increased risk of seizures when they are given with Vilazodone. When this medication is given to the pregnant woman, it can produce pulmonary hypertension in the newborns. This medication can also produce withdrawal effects in the newborns when it is given during the pregnancy. Therefore, use of this medication is not recommended in the pregnant woman. Vilazodone may cause symptoms of sexual dysfunction in both male as well as females. Particularly on long-term use, Vilazodone can cause abnormal ejaculation and reduced sexual desire. Vilazodone is metabolized in the liver by cytochrome P450 system. Two important enzymes are CYP3A4 and CYP2D6. Therefore, when you take the Vilazodone with CYP3A4 inhibitors, the levels of this medication may be elevated. In such conditions, Vilazodone should not be taken at a dose above 20 mg per day. However, when Vilazodone is going to be taken with moderate CYP3A4 inhibitors like erythromycin, some less effect can be observed. However, if you observe any intolerable adverse effects like confusion, dizziness, and drowsiness, it may indicate the elevated levels of Vilazodone. In such conditions, again the dose may be reduced to 20 mg per day to minimize these side effects. A quite opposite effect can be observed when Vilazodone is taken with CYP3A4 inducers. For example, carbamazepine is a CYP3A4 enzyme inducer. When this Vilazodone is taken along with carbamazepine for at least 2 weeks, the efficacy of the treatment may be reduced because of decreased levels of Vilazodone. In such conditions, the dose may be increased by 2 times. However, the maximum dose should not be above 80 mg per day. Withdrawal symptoms. This medication should not be stopped suddenly, particularly at higher doses. Sudden stopping of usage may bring few withdrawal symptoms. This may result in dizziness, headaches, trouble sleeping, anxiety, agitation, numbness, and tremors. When you are going to stop the dose, gradually reduce the dose because sudden discontinuation may produce these withdrawal symptoms. Particularly when you are taking at 40 mg per day, the dose can be reduced to 20 mg per day for 4 days. Then it can be reduced to 10 mg per day for 3 days. In this way, within a 1 week gap, the dose can be reduced from 40 mg to 10 mg. Similarly, if you are taking a dose of 20 mg per day, the dose can be reduced to 10 mg within 7 days. Now let us see the side effects of this medication. Vilazodone mainly produces common side effects like diarrhea, nausea, vomiting, and insomnia. It can also produce dry mouth, abnormal dreams, loss of libido, and abnormal ejaculation. Few gastrointestinal side effects like dyspepsia, flatulence, and gastroenteritis can be observed. People may also have sleepiness and restlessness. How is it given? This medication is available as tablets at different strengths: 10 mg, 20 mg, and 40 mg. This medication should be taken with food as food increases the absorption. Taking Vilazodone in fasting conditions may reduce the absorption, thereby reducing its effectiveness. For the treatment of major depressive disorder, this medication can be started at 10 mg once a day. This medication can be taken for 7 days along with food. After 7 days, the dose can be increased to 20 mg taken along with food. Based on the clinical response, the dose can also be increased to 40 mg per day after at least an interval of 7 days. The target maintenance dose may be 20 to 40 mg per day. One of the important things is that this medication should always be taken with food to produce significant absorption. So that's all about this medication Vilazodone, which is a new antidepressant which is having the dual action. It acts like SSRIs so that it can reduce the uptake of serotonin. It can also act as a partial agonist at 5-HT1A receptors, thereby it can improve the serotonergic transmission. This medication should be given along with food to produce significant absorption, and it shows its beneficial effects after 6 to 8 weeks of the treatment. Vilazodone can increase the intraocular pressure and it may increase the risk of glaucoma in the people. It can also increase the risk of bleeding, particularly when it is combined with anticoagulants and other NSAIDs. On long-term use, this medication can produce sexual dysfunction leading to loss of libido and abnormal ejaculation. However, with proper precautions, this medication can elevate the mood and improve the symptoms of depression. So that's all about this medication Vilazodone. I hope this video is useful to you. If you really like this video, please subscribe to our channel and hit the like button. Share this video with your friends and post your comments in the comment box. Thanks for watching. See you in the next video.